The CDC reports the coronavirus pandemic is causing a large number of Americans to suffer from a variety of mental health issues, such as suicide, depression, and substance abuse. People from all walks of life are experiencing these issues in greater numbers. However, the numbers are much higher, disproportionately worse, in fact, in young people, minorities, essential workers, and unpaid caregivers. CBN's medical reporter Lori Johnson is here to give us more details on this. So, Lori, these numbers may not surprise anyone. Didn't health experts predict this is what we'd see?
Absolutely. And it's kind of a no-brainer. Back in March, when they started talking about lockdowns, not going to school, not going to church, not going out to work, people are like, wow, that's going to really affect people mentally. And we're seeing that the number of people who are depressed is 4 times greater than this time last year. The people who have anxiety disorder, 3 times greater than this time last year. The number of people who are seriously considering suicide, double what it was this time last year. And people are reporting 1 in 10 people report either beginning to abuse substances or abusing the substance they already abuse more so. And we're seeing the main reasons for these problems is because they are afraid of getting COVID and dying from it or having serious complications, afraid of getting it and giving it to somebody who would die. Also, of course, the financial implications and social isolation.
Horrible. So what can people do to avoid becoming a statistic?
Well, the CDC has issued some guidelines, and the first thing they say is get help. And the good news is that there's the telehealth. So you can contact a mental health provider, a psychologist, a counselor, a psychiatrist, and do the appointments over the phone or on a screen if you Zoom or FaceTime. Also, you can, a lot of these people are doing office hours now. You have to wear a mask and maintain social distancing. Also, make the effort to heal yourself to the extent that you can. What do I mean by that? Go out and try to connect with people, call people, try to Zoom with people or FaceTime with people or get together with people and social distance outside, wearing the mask and everything. But a lot of people, when they become depressed, they isolate even more.
Absolutely.
So you need to try to get out there. Another thing that we do is we eat a lot of the comfort food, which makes us feel better at the time. But believe it or not, Ephraim, comfort food and unhealthy food actually affects our mental status. So eating healthy foods like salads and even going without food, intermittent fasting, so like for 12 hours a day. So stop eating at 6 p.m. and don't eat again until 6 a.m. or even longer. Believe it or not, that's been shown to help your mental capacity and other neurological issues. So also exercise. And so we know the gyms are closed, but you can exercise outside or you can exercise at home in front of the TV. There are all kinds of classes you can take right on the TV and do jumping jacks and push-ups. You don't even need any equipment.
Tons of apps to get to work. Let's talk about teens in particular. We know an already growing suicide rate and drug overdose rate is getting bigger now due to COVID.
Right, and you can understand this because of the social isolation that these teens are feeling. And for teenagers especially, it's hard because during these years are when people start to look to their future. They start to plan out their lives, and they're looking at, they don't get to go to graduation. Now we're seeing they don't even get to go to college. They're not being able to get married. They're not even dating really that much. And so they're thinking about, what am I going to do for my life? Job opportunities, and all that seems very negative right now. There's very little hope about the future. And then we think about teenagers, younger children really especially need that structure of school. And it's very hard on them emotionally and mentally to not go to school. We know there are challenges of going to school too. So we really just need to pray for everyone. One more thing, these are people who really need our prayers, are the folks who are unpaid caregivers. We're talking about people who are taking care of their elderly parents. They are under an enormous amount of stress, especially if they have to go out into the world and work. You think about people who work at a grocery store and come into contact with people all the time, then go home and take care of their very sick parents. Or if you live in a small apartment and you have children there, they're going out and about. Sick mom at home, you're going out. It's really understandable why people are so stressed out.
Indeed, indeed. Lori, thank you so much. I want to remind you at home that you can always get more information by tuning into Healthy Living. It begins this evening at 9:30, and you can find that on the CBN News Channel.